Hospital for Special Surgery is uniquely positioned to provide not only the best care for the routine musculoskeletal problems, but also for the more complex problems that come to us. We have the surgical expertise to deal with the most complicated injuries, most complicated infections, most complicated problems that occur from all kinds of orthopedic and musculoskeletal problems.
The essence of what special surgery is teamwork. It's a community of the best and the brightest working together every day to assure the longest and highest quality life for our patients. It's the daily integration of science with sensitive care.
We have a superb staff of rheumatologists, radiologists, anesthesiologists, and pathologists, all who make our job easier and allow us to provide the best care to these most complex patients. Additionally, our rehabilitation and nursing at the hospital take the patients from their surgical procedures through their recovery.
My first symptoms were a lump in my shin. We noticed it one night when I was taking my shoes off. It was just the angle that we saw, so we decided to present it to a doctor.
Yeah, Ian was referred to me by Dr. John Healy, who is the chief of tumor at Memorial Sloan Kettering, which is an affiliate of Hospital for Special Surgery. Ian had a large bone tumor in the middle of his tibia. So he had an osteosarcoma, and it required a 17-centimeter resection, which essentially means that he lost about 60% of his tibia right in the middle.
It was very scary. I mean, my whole life prior to that, I had been an athlete, and it was very strange to not have certainty. In fact, only 2 or 3 weeks before my cancer diagnosis, I had received my first letter from a Division I school. My dream was to play Division I college basketball.
The idea of a limb salvage reconstruction, in other words, saving the leg, is something that has really become advanced in the past 10 to 20 years. This is an example of a bone defect. Now this is only a 5-centimeter defect. This is a tiny defect compared to what Ian's defect was. But essentially, when you have a defect like this, the goal is to get this piece of bone and this piece of bone to heal to each other. And then with an apparatus, we slowly pull this bone down. Now what happens is this is working its way down to here, but at the same time, this is going to be new bone.
My bones moved 1.5 millimeters a day. Over a 4-month period, they eventually met in the center.
The idea of this type of reconstruction is very special because when you have a reconstruction of the leg with live bone, it doesn't wear out over time. I mean, it's essentially like healed bone over a fracture. And over years and years and years, it actually only gets stronger and stronger, and it will be with him for the rest of his life.
It's in the process of healing, and Dr. Rozbruch has given me permission to pursue activities. You know, I have free rein on what I can do, whatever I'm comfortable with. I can walk again, and my life is back.
Here at the hospital, we have a broad group of physicians and surgeons all focusing in on the same type of problem. And the patient really benefits from that in that they're getting a comprehensive look at their disease process or their problem from many different facets.
Radiologists are consultants to our physicians, and we interact with them before surgery, during surgery, and after surgery. We can provide the appropriate information, answer the necessary questions so that the complex cases can be dealt with in the most appropriate way. Even our routine films are not considered routine, just like the surgery here. Even the routine surgery is not routine. It is special. All imaging is not created equal. You can take a picture, Ansel Adams can take a picture. The picture has got to provide all of the answers and all of the details, and then be interpreted accordingly.
MRI is a very dynamic technique and changes literally on a yearly basis. We've been able to stay ahead of the new technology largely through our collaboration with GE Healthcare. We've been able to gain research support and really explore these new technologies, exploit new markets, and really help a lot of patients in doing so.
The extraordinary thing about special surgery is that the whole is greater than the sum of the parts. And when the parts are world class and the best of the best, this is what you get with regard to care for patients.
I went to a store, and then I went in. When I came out, I started to walk, and I almost went down because my knee gave way. And that's what then me talk to the doctor. I go for the MRI, and when the MRI comes back, that shows that I got bone fragments, no cartilage left, and arthritis in the knee. And we set up a date, went in, we got operated on, and I was starting to move around a little bit, and then all of a sudden it was like I hit a brick wall.
Mr. Sgambati had had a fairly long course of treatment prior to seeing me in regards to his knee. He had had a knee replacement a few years beforehand, and unfortunately that had gotten infected. He subsequently had it removed twice before he came to me, so clearly things were going in the wrong direction.
For me to get from here to the window, I had to hop. Couldn't walk, couldn't do nothing.
He was malnourished at the time and really debilitated because he had been in institutions for months on end. It took about a month and a half to get him a little bit more medically stable. And then once we felt that we were comfortable in terms of eradicating the infection, we went ahead and put in a new, more involved hinged knee prosthesis.
After he got the knee put back in the last time, which was in April of last year, it's like he had almost no pain at all, which really impressed me, because he's got metal from the middle of his hip down to his shin, which is not a normal knee replacement.
He has rods that go both down into his tibia as well as up into his femur, and this is the hinge mechanism that it really replaces all 4 ligaments that in his knee.
What really impressed me was that they leave him in recovery for like over 12 hours before they take him out and put him into a room. And at the other hospital he was in, they didn't do that. So I was comfortable going home without seeing him that night because I knew they were taking care of him.
Hopefully, I may be able to run around a corner one day.
Patients are very informed in this day and age about quality institutions and where to get the best care. Our physicians and surgeons not only are great clinicians, but they're also people involved in research and education. And patients know this, and they come for that specialized care that only they can receive at special surgery.